Dentistry would be dead if big food changed.
Oh.
Why do you have bleeding gums? Why do you keep getting cavities? Functional dentistry looks at root causes. So the mouth is the gateway into the body. If you eat a more ancestral diet, paleo, whatever, less ultra-processed foods, your decay rate, it almost becomes zero. It's essentially preventative medicine. We want to help prevent oral disease. However, we've normalized it because it's so common. We want to start treating kids while they're still growing so we can manipulate and change the way they grow. Your wisdom teeth have no room to come in because your jaws are small. We used to chew, we estimate, about 4 hours a day, and now we chew 4 minutes a day. This is why we have so much crowding. This is why we have so many airway issues. And this is where you hear of people having to have their permanent teeth, like premolars, extracted. They call it 4 on the floor.
Wow.
4. If you're having fertility issues, one of the first things I say is, what's your oral health like?
Wow.
Let's do some oral microbiome testing.
So what is the connection between somebody who does cocaine
Yeah.
and chronic breath?
Yeah. Should we avoid fluoride? What's the deal?
Okay, buckle up.
Dr. Staci Whitman, thanks for coming on
Hello.
the show. Yeah, we met you at the functional medicine event by Dr. Cabral.
Dr. Cabral's event, yeah.
And Justin was sitting at your table.
Yes.
And Justin is typically not the one of us that's like, we got to get this person on the show. Sometimes he is, but not usually. It's either Adam or I.
Yeah.
He's like, you need to meet this woman. Aww. And I'd never heard of I didn't know that there was functional dentistry. Mm-hmm. I know functional medicine. Mm-hmm. And when he said she does functional dentistry, I was like,
so unique, yeah.
And I was like, oh, of course, because you have functional medicine. Why not functional? So can you explain functional dentistry to our audience? Like, what's the difference between that and like conventional dentistry?
Yeah, great question. Thank you, Justin. Yeah. That was fun, by the way. I had a great night. So it's unfortunate that the mouth has been separated from the body. I mean, it should just be functional medicine all inclusively, but dentistry went this way, medicine went that way. That's a whole separate story. But like functional medicine, functional dentistry looks at root causes. So why do you have oral disease? Why do you have imbalances in your mouth? Traditional dentistry, you go in, they look at the x-rays, and they tell you have gum disease, come back for cleaning, or you have cavities, come back for filling. So it's dealing with end-stage disease. I like to think of conventional dentistry a little more surgical. You're fixing the issue, something that's kind of a full-blown fire. But functional dentistry wants to know the why. So why do you have oral dysbiosis or imbalances in your bacteria? Why do you have bleeding gums? Why do you keep getting cavities? And it's not just your diet and hygiene. We know there's a lot of intricacies from the oral systemic connection. So the mouth is the gateway into the body. So we can see nutritional deficiencies, there's gene SNPs, how you're breathing. We do a lot more lab work. We test the oral microbiome. So just like you test the gut microbiome, you can test the oral microbiome, vitamin D deficiency, micronutrient deficiencies, gluten sensitivity, celiac. All of these things can be tied back to oral health. And so we want to help prevent, it's essentially preventative medicine. We want to help prevent oral disease because most oral disease is truly preventable. However, we've normalized it because it's so common.
Wow. Okay, so let's talk about
how far back does the origin go? Like, when did we make this decision that someone needs to intervene and create some sort of functional dentistry when we were heading that? When did that happen?
When did functional dentistry happen?
Yeah.
Gosh, that's a great question. Functional medicine came about in the 1990s. Dr. Jeffrey Bland was the pioneer there. We've heard of Dr. Mark Hyman, of course, and there's the Institute for Functional Dentistry. But I'd say it's been evolution since then, since that became kind of a normal term. Yeah. But most people still haven't heard of it, right? Yeah. So it's kind of still up and coming. It's more prevalent on social media, but there aren't many of us out there looking at oral health this way. Yeah. And I have actually co-founded the Institute for Functional Dentistry, which is launching this summer. And we're affiliate partners with the Institute for Functional Medicine because what the issue is, anyone can call themselves anything, but there's no standardized training right now or certification. And so unfortunately for the consumer, for patients, you think you're going to someone that's thinking differently or practicing differently, but maybe they're not really because there's just no standardization. So we're trying to work on that to correct that. But I'd say it's fairly new. Yeah. Okay. Yeah.
Let's talk about cavities for a second because that's one of the more common things that people are familiar with. So I'll as a personal example, my parents couldn't be any more different with how their teeth, I guess, react or respond to their environment. My mom very cavity prone. My father, he grew up very poor, Sicilian, didn't even have a toothbrush growing up. When he came to this country, dentists did not believe that he'd never been to a dentist and couldn't believe that he never got braces, never had a cavity. And then you have me and my siblings where I am not cavity prone whatsoever. And my sister was just getting cavities left and right. We ate the same diet. I'm assuming that has to do with the microbiome of our mouth more than anything. Okay, what's going on there? And how do you change that? Or what are the things you can do to change the microbiome to be I guess more positive for oral health?
Yeah, there could be a few things at play. So the quality of your enamel matters. How mineralized are your teeth? We are seeing an uptick in under-mineralized teeth in children now. It's something called hypoplastic enamel. And that essentially is, if it's dealing with baby teeth, that usually happens in utero. And if it's adult permanent teeth, that's usually in the first formative years, kind of 0 through 8 years old or 10. Theories are it can be due to environmental toxins or exposures, but we're very mineral deficient. We're vitamin D deficient. Our soil's depleted. So this is epigenetic, generation after generation after generation. So we are seeing alterations in the actual enamel integrity. It can be from mold exposure. It can be from a high fever. Were you on antibiotics? Was there some sort of event that affected enamel formation? Microplastics are now being linked to issues with enamel formation because amelogenesis or enamel formation, it's hormone driven. So, endocrine disruption. Microbiome does make a difference too. When I hear that though, this sibling does this sibling does that, one gets cavities, one doesn't. The first thing I think of is mouth breathing. So, and this is an important thing that we can get into, but airway health and how you're breathing significantly impacts your oral health. So if you are a mouth breather, your mouth will dry out. Your saliva is very protective of your teeth. It contains nutrients, enzymes, immune cells, hydroxyapatite, calcium, phosphorus, things that are needed to neutralize and buffer and restore your enamel health. And also the pH drop. So your mouth is constantly acidic if you breathe through your mouth. So often I wonder, are you a mouth breather? Do you have sleep disordered breathing? Do you have sleep apnea? Okay, and those can have profound downstream effects for the systemic health also. But yes, the oral microbiome could be at play as well. If you mouth breathe, your oral microbiome will also be different. It'll be more prone to pathogens. Pathogenic bacteria love acid. Healthy bacteria love more of a neutral salivary content or even alkaline. But the only way to know really is to test. So there is salivary analysis or oral microbiome testing. It could also be gut health imbalances. If you have intestinal permeability, you're not going to be absorbing nutrients appropriately. Are you dehydrated? So there's a lot that can go into it. And this is part of functional dentistry is that we would do a workup in the patient to try to say, well, why does your sister get cavities all the time and you don't when you have similar diets and hygiene practices? The other thing, too, is many people think they're eating similarly, but they're actually not. Yeah. And it's not only foods that we eat, but it's eating frequency. This is something many people don't realize. But anytime you eat or put anything in your mouth, aside from water, arguably, your mouth pH and microbiome will shift and change. So we want to make sure that we're timing things appropriately. So we tend to be a society where we snack and graze and sip all day. So just like we need to be giving our gut a rest, we're supposed to not be eating all the time. You're supposed to be giving your mouth a rest too. And so eating more on a schedule is very important because if you're constantly sipping and stacking, your mouth is constantly acidic. So the acidity helps with food degradation. So it's part of the digestive process. Enzymes are released to break food down. This is normal, but if we wait, our saliva will naturally buffer and raise the pH of our mouth again. So we are supposed to take pauses between eating. And this is where the sipping on the Frappuccino or, snacking on those goldfish crackers, it really can make a big difference. So I'd be curious about eating frequency too.
How long of a break do you typically recommend?
Every 2 hours is ideal. That can be hard with kids, but this is where protein comes in. We really want a very high protein breakfast to start the day off light for blood sugar regulation. That's important with our children too. so many of our kids, and we're marketed to as busy parents, the goldfish crackers, the Cheerios, the fermentable carbohydrates. That's trashing their oral microbiome, their pH, but also their blood sugar too. So
there's truth to the whole grains and sugar can cause cavities.
Yes, flour is sugar in the mouth. So I think goldfish crackers are one of the worst things for teeth, and is one of the top reasons that our kids have so many cavities.
Oh, wow.
Cavities are the number one chronic disease globally in the world. And it's almost entirely preventable, but we've normalized it. So 90% of people can raise their hand up in a room and say, I've had a cavity before. Think about if that was for any other disease. We'd be like floored, but we're like, it's a cavity, but our teeth aren't meant to degrade. Ancestral humans, if you look back 10, 12,000 years ago, which wasn't that long ago, we didn't really suffer from cavities. If you go to the Natural History Museum, you look at skulls, the teeth are pretty pristine. Now, in areas where there maybe was higher fruit, access to fruit, maybe honey, you might have seen a couple cavities, but not the rampant decay that we see right now. They estimate 100,000 or 150,000 children undergo general anesthesia, have their teeth fixed a year in the United States.
Wow. Today's program giveaway is MAPS Split. If you want to win it, do this. Leave a comment below this video in the first 24 hours that we drop it. Subscribe to this channel. Turn on notifications. If you win, we'll let you know in the comment section. We also have a sale this month. MAPS Performance and MAPS Performance Advanced, both 50% off. You can find both of them at mapsfitnessproducts.com, but you have to use the code MARCH50 for that discount. All right, here comes the show.
Now, is cavities, are they reversible in terms of them being able to heal, or is this practice of getting drilled and then, going through that even necessary? Or is it at what point do you have to intervene? Or would you say is probably a good idea?
Yeah, great question. Cavities are reversible if caught early. So our mouth is constantly in a state of demineralization and remineralization, and that has to do with that acidity. Okay, so anytime we put anything into our mouth, our teeth will become demineralized. But then if we allow a break and the saliva to do its thing, we will naturally remineralize. So if you catch a cavity still in the enamel, when it hasn't created an actual cavitation or a hole, you can fill that back in with minerals, specifically hydroxyapatite, or some people choose to use fluoride, which our teeth don't have fluoride in them naturally, and we can get to this later. But that's where remineralization can come in. Now, if the cavities are a little bit deeper through the enamel into the next layer of the tooth, which is called the dentin, it's a lot harder to reverse, but sometimes you can arrest it, which means just freeze it in time. And this is a great strategy for kids because pediatric teeth fall out. They are important. I don't want to, say we can ignore them. But to me, putting 150,000 children under anesthesia a year for teeth that do eventually fall out with the risks of anesthesia. And we're learning more and more about the potential risks to brain health, and also there are negative outcomes. Anesthesia generally is very safe, but I think we need more research about what it's doing to the brain, the developing brain. We've just normalized just putting children under sedation. So these are great strategies, in my opinion, to try to just delay, kick the can until these teeth eventually fall out.
I've been dying to have someone like you to explain. And I know you guys do you remember the story I told of so I made a big,
I was trying to bring that up.
Yeah. So years ago, I made a big stink on the podcast that I believe that dentistry is a big scam. And I told this story.
You said the same thing about chiropractors
too. That's a true story. This is a true story. This happened to me. And I feel like you can explain this. So growing up, we were very lucky if we got to see a dentist once every few years, okay? And I went to the dentist. I'm young. At this time, I'm probably 12 years old or so, give or take. Go to the dentist. Dentist tells my mom that I have 7 cavities. We don't have the funds to pay for that time. So mom says, well, that sucks to be you. Deal with it type of deal. 2 years goes by. I don't see a dentist or anything like that. As far as I know, I don't know what potentially happened in my diet or what happened in the next 2 years, but I go see a dentist 2 years later and I have 0 cavities. Yeah. So and that was the moment all of a sudden all this disbelief come in that this must be some sort of a scam because I know I didn't go try and fix anything. I just went about my life. And 2 years later, I eliminated 7 cavities. Yeah. How was that possible?
Yeah, lots to unpack there. I'm not offended with your comments about dentistry. Okay. So I will say, dentists, I believe overall are a great profession, well-intentioned. But even I think my own profession could be a bit of a scam too. I think we very much over-treatment plan, and part of this is our training. I don't blame the dentists. I blame the teaching institutions and the way we're educated, because we're educated to only deal with end-stage disease. You need a cleaning, you need a filling, you need a root canal, you need an extraction. But what about all these metrics upstream to help the patient, learn what happened, what went sideways? How can I heal this without you? Now, I will say part of my practice is I get a lot of second, third, and fourth plus opinions. And I will make a generalization that I think that a lot of dentists over-treatment plan, especially in kids. So there are cavities that are really small. We call them incipient. And we could watch those. We could try to remineralize those. We could talk about changes in diet, hydration, eating frequency, breathing. I see cavities heal all of the time and remineralize in my practice. So also, I wonder if you truly had 7 cavities. That would be my argument. You may not have. And very often this is true. I have patients come in with a treatment plan. I see the actual physical printed out treatment plan, and it's 8 crowns. It's a baby teeth. 8 crowns in the baby teeth. They need crowns in the front or extractions. The child needs anesthesia. And there have been times I look at the x-rays and I look at the sheet and I look back and forth and I ask my assistant, are you see what I'm seeing? And there's maybe a couple watches.
Oh, God.
So this is how I felt, because I remember my mom at that time, I think if I was in pain or complaining, she would have done something about it. But I remember telling her, I feel fine. Yeah. I don't notice anything. I don't feel anything. So it just seemed odd. And
right. And I think we take ourselves a little too seriously. There is a difference too with adult teeth. I think we need to prioritize adult teeth. If there is a cavity into the root canal system, if you get an abscess in adult tooth, that can lead to facial cellulitis, hospitalization, potentially death. But when we're talking about baby teeth, I have never seen any of that, nor have there been case reports, and we have to think how many kids are walking this planet without access to care. Think about in Southeast Asia and Africa, all these places that just don't have routine dentistry like we do here in the United States. These kids they're eating a Western diet. I'm sure they have cavities, but they eventually do fall out. So it's time and place. If a child's in pain, if it's affecting other things downstream, we should treat that. But I also believe we should be giving patients an option. And this is where dentistry fails also. You're supposed to present treatment options, get informed consent. So treatment option 1, no treatment. I don't recommend that, but that is an option. Treatment 2, we can take this conservative approach. We could try to arrest and remineralize. We could try to make shifts in hygiene, nutrition, etc. Treatment option 3, we could just do fillings. The fillings may fail, but do you want to try them? 3, crowns. There should be tiers so a parent can decide, or a patient if it's an adult. But dentistry tends to be like, you have to do this. You need a root canal. You need this, So I do believe, too, if you see 10 different dentists, you'll get about 10 different opinions.
Yeah, that's crazy.
And not to be cynical, but there is a lot of insurance fraud out there. There is. I've worked at offices where it's been going on. And that's not to say every dentist is practicing this way. Those are outliers. However, trust your instincts. And there's a lot of wonderful providers out there. So if you just feel uneasy, trust your gut. Go get a second opinion somewhere.
So I had another thing that happened to me, which again led to this attitude that I had towards dentistry, which was this was in my adulthood. This wasn't even that long ago. I was drinking 2 rock stars a day in the morning when I was training these boot camp classes back in the day. This was 10, 15 years ago, about 15 years ago now. And I actually, it started to get enough of a cavity where I could see the hole burrowing down. Went in, saw the dentist. Dentist said, yeah, absolutely, you have that. And I said, okay, well, what could be some of the things causing it? And then I told her what I was doing. She's like, oh yeah, you probably should lay off the rock stars. So I said, okay, well, I'll come back. We'll fill this. I don't want to do it right now. It's not bothering me yet. And again, I'm still skeptical. So I thought, what happens if I just cut these out, really start flushing my mouth with water and stuff like that and avoid it for a while? And sure as shit, I did that. and they healed themselves. I didn't have any problems anymore.
Yeah, it probably was still in the enamel.
Okay, so that's a case where it hasn't penetrated deep enough.
Yeah.
Okay.
You took away, so Rockstar is extremely acidic.
Yes.
This is what we forget. We think it's just soda, sugar, but it's acidity. Like even sparkling water has a lower pH. So just being mindful of these things.
Yeah.
Drinking with a straw can really help. I know
that was actually her suggestion.
Yeah.
If I couldn't break the habit, she's all, if you go back to it, at least use a straw.
Yeah. It's not like super tough to walk around with a straw. However, your
I
teeth,
avoided it.
I did do that for a while, just so you know.
Well, it will help with erosion, dental acid erosion. And
she also recommended, like, let's say if I was still doing it, she goes to drink, I think, a pH balanced water in between and like flush.
You could rinse with alkaline water or just baking soda and water.
Okay.
Cheap.
Wow. So I remember, I as a kid, I would say I was a teenager. They recommended that I pull out my wisdom teeth. Now, as a kid, I'm just naturally, rebellious. And so I remember thinking, this doesn't make any sense. Why is everybody getting these teeth pulled out? How the hell did we do this before we pulled out wisdom? So I never got my wisdom teeth pulled out, which, by the way, didn't bother me. I'm totally fine. What's the deal with that? Is it necessary? And if it is necessary, what happened to our mouth where wisdom teeth have become a problem? We've had them since, forever.
That's right. Great question. So this is part of functional dentistry too, is focusing on growth and development, facial development, and airway. Okay. So you were right. Ancestrally, we had wisdom teeth in our jaws. They look great. If you go to that natural history museum, count the teeth, you'll see wisdom teeth in there. They're perfect. This helped with mastication. We were hunting and gathering and foraging. We needed to be able to chew properly with these big, strong, wide jaws. So what has happened in the past 12 to 10,000 years? Well, the agricultural revolution happened. So we started farming corn and soy and wheat, okay? And then, so we moved away from hunter-gatherer to agrarian. And then the industrial revolution happened where we started milling and processing foods and adding sugar and adding flour. So this has so many health issues, including cavities, oral microbiome changes, but we stopped chewing. So we used to chew, we estimate, about 4 hours a day, and now we chew 4 minutes a day. So Go-Gurt, Slurpees, Rockstar, just mushy. Chicken nuggets.
Dramatic of a difference?
Over 12,000 to now. This is what the anthropologists estimate.
Holy smokes, that's a big difference.
So chewing, it strengthens the jaws. It creates lateralized forces outwards. The same with breastfeeding. And so it grows the face, it grows the palate, it grows the midface, it grows the jaws wider. So form follows function, okay? In a battle between muscle and bone, muscle always wins, all right? So we're not chewing. And this isn't just our generation. This has been epigenetic, okay? So our jaws are shrinking. This is why we have so much crowding. This is why we have so many airway issues. So if the jaws are small, it's just surface area. The teeth can't come in. They come in all crowded and rotated. Your wisdom teeth have no room to come in because your jaws are small. So to answer your question, do wisdom teeth need to come out or not? It really depends on the individual. Do you still have optimized facial development and jaw development, or do you not? Now, part of functional dentistry is to catch this early in kids. I can tell as young as a 1-year-old that they're probably going to have jaw discrepancy issues, and we intervene early. There's a phrase now, fix by 6. We want to start growing the face. We only have one opportunity to grow a face. And so if you intervene early, generally with retainer therapy, sometimes myofunctional therapy, which is like physical therapy for the face, the mouth, the muscles of mastication, breathing, you can course correct and you can get these kids optimized to technically how they should have been ancestrally.
Wow.
And so maybe they still won't have room for their wisdom teeth, but it's the best shot, And so the problem with the wisdom teeth, if they come in horizontally or impacted, they can get infected. They can cause resorption of the adjacent teeth. And sometimes if you're really stubborn and you're like, I'm never going to get my wisdom teeth out, they can take out the tooth next to it too. So just make sure you're seeing someone you trust. And this is a case to get a second opinion. Maybe work with a functional dentist or someone who looks at things differently.
So my wife was really big. So she's really big in functional health. And with our 2 little ones, with kids, with babies, you're constantly encouraged to give them mashed up food, never let them chew.
Yeah.
And my wife's like, no, they need to chew on things because it's good for their jaws. And so she would give, and my kids are a little older now, 2 and 4, but even when they were younger, she'd give my son or my daughter like a lamb lamb chop.
Good for her.
And they would just chew on it. And I'd freak out because I'm like, you're going to choke. What if she's like, they're not going to pull anything off. And they would just chew on it. So that's essentially what you're trying to do, right? Through that process is give some resistance so that it could grow properly.
Well, imagine what we know about the human body and muscle and skeletal system, what we know. Imagine something that was 4 hours a day going down to 4 minutes, how much that would atrophy.
Big time atrophy.
Any other part of your body that we're familiar with, if you reduced exercise and movement from 4 hours to 4 minutes, that is
forget it.
Yeah.
So she had the right strategy with that.
Serious atrophy.
Oh, she's right. She's spot on.
Okay.
Thumbs up. I totally approve that message. So there's something called baby-led weaning, and that's when you mostly are introducing whole foods to your babies instead of purees. Some people do a blend. I'm not in one camp or the other, but you want to make sure you're not presenting things that could be choking hazards. There's all kinds of books and blogs and things on this. But yes, introducing whole, real foods, getting away from the rice puffs and the Go-Gurts and the, squeezy pouches can make a big difference. But unfortunately, we are battling generations of this. So you can throw everything you want to at it, and your child may still have crowding and need interventive orthodontics early, but at least you're trying to optimize it as best as possible.
Is this also the cause of braces?
Yes.
Okay.
Yeah.
But the difference with braces, time and place for braces, but a lot of cases, and this is definitely contentious. So there's kind of functional orthodontics now and then conventional. Functional orthodontics, we want to start treating kids while they're still growing. Okay. So we can manipulate and change the way they grow. And that's often, again, with retainer therapy. If you wait too late, most facial development is done around the age of 10. 11, 12. Well, traditional orthodontics, you usually wait.
You wait.
For all the baby teeth to fall out. It's adult teeth. You're not going to change the face or the jaws. You're just moving teeth around to make them Hollywood aesthetic. And this is where you hear of people having to have their permanent teeth, like premolars, extracted. They call it 4 on the floor.
Wow.
4. And that makes a small jaw smaller. So while the teeth, yes, they line up and fit, the architecture of the jaws are even smaller. So we really want to try to find a dentist or an airway-focused dentist that's helping your kids grow and start early. And it's very controversial at our dental conferences, but I will tell you, the kids, my own included, both of them, we started really early, around 4 or 5 with retainer therapy. You can see it in their face. They have more of that Hollywood aesthetic, the chiseled jaw, if you will, because we grew their face wider and their jaws wider, their teeth all fit. They're not getting any braces. They're 9 and 11. So early intervention, again, upstream. This is functional.
Yeah. The first time I ever heard of anything like this was reading Dr. Weston A. Price.
Yes, absolutely.
And his observations. Now, he talked more about diet.
Yeah.
But so he definitely contributed to some of this and his findings. He would go to these third world countries, and he just noticed like such strong, straight teeth. And he's like, what's going on here? They don't have dentists.
And no decay.
And it was all about the diet.
Yes.
Okay. So
fat-soluble vitamins.
Okay.
So A, D, E, K, which we're all deficient in because of our ultra-processed food diet, minerals, magnesium, trace minerals, organs, organ blends, micronutrients. We're deficient in all of this now because our food, it's big food, big food. Dentistry would be dead if big food changed. It is not a lack of flossing. It's not a lack of fluoride. I would argue, it is so much about diet, everything, and we need to be addressing it. And that's the other thing. It's really easy to blame the toothpaste or the fact that your patient's not brushing properly. But if you change the diet, if you eat a more ancestral diet, paleo, whatever you want it to be, less ultra-processed foods, your decay rate, it almost becomes zero, truly.
Wow.
Because pathogenic bacteria feed on fermentable carbohydrates. That's sugar and flour. They don't feed on meat, dairy, vegetables. You could argue maybe a little bit of fruit, but I'm not going to villainize fruit. But our healthy bacteria like prebiotic fiber, just like the gut. So if you're feeding it those things, you're going to have a very healthy, robust oral microbiome. If you're feeding it more pathogenically, like with ultra-processed foods, flour, sugars, that acidity, preservatives, the food dyes, what are all those things doing to the oral microbiome? You know, they're shifting it, absolutely. And so I wish dentistry focused more on nutrition, but just like medicine, we don't get any nutritional training.
No.
Yeah.
And it's a nutritionally driven disease, essentially. And I'd say airway health too. Yeah.
You mentioned fluoride. We just recently found out that fluoride in water looks like it lowers IQ.
Lowers IQ, yeah.
And you mentioned fluoride along with hydroxyapatite for remineralizing.
Yes.
What's the difference? Is one better? Should we avoid fluoride? What's the deal?
Okay, buckle up. Okay, so I'm going to go back. I was trained traditionally. Every dentist is trained. Fluoride, fluoride, fluoride.
Yes.
You get fluoride. You get fluoride. Don't even question it.
Everybody gets fluoride.
Everyone gets fluoride.
Put it in their water.
Put it in the water. Put it in the toothpaste. Put it in the rinses. Varnishes. You need it. You need so much of it. Supplements. And I used to practice that way. And I live in Portland, Oregon, where we do not fluoridate our water. And about it was almost 15 years ago now. I was involved in the campaign that was pro water fluoridation. And I was picketing and like handing out flyers and buttons. Wow. And I admittedly had not picked up any journals, never questioned it. It was just fed to me in school, and it was the Bible to me, fluoride. I'm a total hypocrite because I wasn't using it personally, because I had read that it's a neurotoxin, potentially can affect my microbiome, my thyroid health. So I wasn't using a fluoride toothpaste, and I was filtering my water when I lived in other communities. What a hypocrite. So anyway, I sat in a debate, pro versus anti-fluoride, okay? And I was sitting on the pro side, and I was looking at the anti group, like Tin Hat Brigade, Woo Woo Caucus, pseudoscientists, and I actually listened to them, and I was floored. I had never heard of the connections with potential systemic issues, that fluoride is extremely electronegative, it's very reactive, it can compete with iodine in the thyroid, cause endocrine issues. Even then, this was almost 15 years ago. I mean, they've been talking about this for decades, the controversy, what it does to brain health, et cetera. So I felt shamed, and I went home and I did my due diligence, and it didn't take long to go through some of the research to say, oh my gosh, we need to take a closer look at this. Okay, so I've been speaking out against water fluoridation now for quite a while. And you need to separate topical fluoride from systemic fluoride.
Right, one you drink, you swallow, the other one you just put on your teeth.
Correct. And fluoride really has been shown to work more topically anyway. It's more efficient that way. It doesn't have to go through the gut bypass system, et cetera. But it really works topically. You just need to put it on your teeth, spit it out, okay? But systemic fluoride, so it's really become popularized now. Finally, mainstream media is talking about it because of all the political association, which is really frustrating because we're ignoring the science. So back last fall, the National Toxicology Report came out. We've been waiting for this for almost 7 years. And that was a report under the Division of Health and Human Services. And it said increased levels of fluoride, absolutely, systemic fluoride absolutely can lead to neurocognitive issues, okay? At that same time, there was a federal trial going on. It was the People versus the EPA. It's called the TASCA trial. And there's a great website from the Fluoride Action Network, which will break down the entire trial. And this trial also had been going on for years. And it was the first time a judge said, I don't want to hear from you dentists. I know you guys love fluoride for the teeth. I want to find out what it's doing to the rest of the body, okay? Because dentists try to be so zeroed in on the tooth because dentistry is here and medicine's here, but the mouth's a gateway to the body. It's all interconnected. It's still part of the human system. So endocrinologists, epidemiologists, neuroscientists, et cetera, testified, and they're very powerful. There's over 70 studies that show some sort of link to neurocognitive issues. Some of them are not great studies, but when you decipher it down, there's at least 18 really high quality studies, which to me, I think you only need one or two to question this. And so the judge saw the NTP report, and then finally made his verdict after 7 years of deliberation and testimonies, and said there's an unreasonable risk to our current water fluoridation practices. EPA, you're responsible for regulating this better. The American Dental Association, a lot of dentists are still saying, well, those articles aren't high quality. That's only an extreme excess of fluoride. But right now, we fluoridate our water in the United States at 0.7 milligrams per liter. But there are studies that show even at that amount, there are concerns. And the IQ concerns are on par with lead. It's a 5-point IQ reduction.
Wow.
Yeah. The other thing people don't speak about is fluoride is antimicrobial. So if you're drinking it and ingesting it, what is it doing to the gut microbiome? The other issue is the halo effect. So yes, okay, let's say it's at 0.7 milligrams per liter, but that's per liter. So are you only drinking 1 liter of water a day? No. Pregnant women are supposed to drink 3 liters of water a day. So are we regulating what pregnant women are consuming? And the most vulnerable are pregnant women and young infants, and infants who are getting formula mixed with fluoridated water. So that's where we're seeing the biggest issue. So the other thing is it's a medical consent issue. And so many don't realize that 97% of the world doesn't fluoridate anymore. This is a very United States centric issue, and they've removed it from their water. They either never put it in their water, or they removed it from their water due to medical consent issues. You know, we're mass medicating without consent, or concerns with health. Okay, the other downstream effects of water fluoridation. But the halo effect is, so it's not only how much water are you drinking, are you cooking with it, are you boiling your pasta with it, are you making your soup with it? Ultra-processed foods, you know, your rock star was made with water. It wasn't filtered. They're not using reverse osmosis in these factories, so it probably had fluoride in it. Ultra-processed foods have fluoride. Many pharmaceuticals now have fluoride, especially SSRIs, antidepressants, have fluoride in them. Many natural foods, you know, we find it in trace amounts in natural foods, black tea, green tea. And I'm not saying don't drink those things, but just know it compounds. Like, how are you calculating it? How are you titrating it? How are you really dosing it based on body weight too? And how do you metabolize things? And different people will have different vulnerabilities as well. So I think we're just oversimplifying it. And the other issue is we don't have cavities due to lack of fluoride. You know, fluoride's not an essential nutrient. No system in the body depends on it. We are getting cavities because of our diet. You know, so we're masking the issue. To me, it's like I get a headache every day, so I take ibuprofen. Well, fluoride may topically make your teeth more acid resistant and lower your cavity risk. But if it was really working as well as it says as we think it is, why are cavities still the #1 chronic disease globally? Right. And the United States, a majority of people are exposed to fluoride too. So I just think it should be removed from the water. It's also a risk thing. Like, I'm a low cavity risk. Why should I be forced to drink fluoridated water when someone else is a high risk? And maybe they do need more fluoride. And I'll get to hydroxyapatite in a moment. But, you know, and some dentists will say, well, people can just filter their water or buy bottled water. Well, many people can't afford reverse osmosis systems. And now we're talking about microplastics in bottled water. You know, like it just should be a choice.
Is any of it absorbed through the skin, through showers? You need to be worried about that, like baths and showers?
I do. I haven't seen any solid science on that. But of course, it's just what is the cumulative effect? Gotcha. We don't know. Okay. But I would like to see more studies on this. And I'd like to see more studies on the microbiome too. What is it doing to the gut microbiome particularly? Yeah. So I think it should just be a choice. If you want to use fluoride, go to the store, buy fluoride toothpaste, use it on your teeth. But this is what they do in Japan. Japan has one of the lowest cavity rates in the world. They don't fluoridate their water, but they do a lot of oral rinsing with fluoridated mouth rinses. Okay.
Aren't they one of the highest protein consumption too?
Hong Kong.
Oh, Hong Kong. Not Japan.
Well, and they also have a very clean diet.
They do.
You know, so that matters. Yeah. So hydroxyapatite, hydroxyapatite's been around since the 1970s. It was actually NASA that first developed it because when in this space program, they realized when astronauts went out anti-gravity, they lost minerals. So their teeth became mineral deficient. So they were like, well, let's create this hydroxyapatite compound. Japan came in, actually, scooped it up, patented it. And so hydroxyapatite, which is calcium and phosphorus, has been used in Japanese toothpaste since the early 80s. So your enamel is composed of hydroxyapatite, about 90% hydroxyapatite crystals. Our bone is about 60%. Just so this is a naturally occurring, compound in the body. And it now is becoming more popularized in the United States. So it's been used in Japan, South Korea, Italy, many European countries for decades, but it's kind of newer on the US scene and everybody's very skeptical of it. But I will tell you, my patients who use it, I've seen such tremendous improvements in their oral health. And I think not only is it more biomimetic, mimicking nature, but it doesn't have that antimicrobial component to it too. So, but we're all different, and you might do better with fluoride. You might do better with hydroxyapatite. There's microhydroxyapatite. There's nanohydroxyapatite. And it's not just that. When you look at oral healthcare products, what are the other ingredients? So just like you need to read labels for your food, there's oral microbiome disruptors in a lot of oral healthcare products. There's emulsifiers, surfactants, foaming agents, essential oils, which we think are good, but they're antimicrobial. So we're so used to carpet bombing the mouth, kills 99.9% of germs. That's not a good way to be behaving. We want to nourish and preserve our microbiome. So less is more. So you really want to be mindful of the products that you're using, just like you are with our makeup and our shampoo and our deodorant. It's the same.
I saw they were putting triclosan in toothpaste.
Gross.
Click here if you want the world's best probiotic seed, and also get 25% off.
How bad is mouthwash?
Good question. It depends on the type of mouthwash, but traditional conventional mouthwash, like your Listerine, your alcohols, your astringents, you should not be using it.
Those are bad.
Chlorhexidine, it's banned in many countries in Europe, but it's still used here. It's just carpet bombs the mouth. And it's because of the alcohols, the astringents. They're not selective. And there are studies now that show people who repetitively use these alcohol, astringent-based mouthwashes have high blood pressure, cardiovascular issues. Why is that? Nitric oxide. So there's bacteria on the dorsum of our tongue that are responsible for the nitrate-reducing pathway and help contribute to nitric oxide formation. So if you're carpet bombing the mouth, you can be impacting nitric oxide formation too.
So you're not going to have worse pumps?
Not going to get
That's the first thing.
No, it's true.
That's the first thing I ruined my pumps.
Yeah. Sexual health, like all kinds of things that comes from the mouth. And
interesting.
Paranasal sinuses, when you breathe through your nose, nitric oxide is created there too. So mouth breathers tend to have more cardiovascular issues, more erectile dysfunction. A lot of that is just how you're breathing. So it's microbiome.
Are there any applications? What was that one you mentioned? Something compounds in mouthwash?
Chlorhexidine.
Are there any applications for that where you might want to use it?
Yeah, great question. I would say if you have active periodontal disease, work with your doctor, but let's say you have really virulent pathogens. And this is where oral microbiome testing comes in, and we should speak to this. You may want to have some more heavy hitters, whether it's antibiotics or stronger, agents, but temporary, like just for a few weeks until you see stability, not repetitively.
Got it.
I think of these mouthwashes as like deodorant or perfume, like it's just masking the issue. So if you find you always need mints or gum or you always have bad breath, there's something else going on. You are not in balance, so you probably have dry mouth or oral dysbiosis of some sort. It could be coming from the gut too.
So
all plaque and tartar and stuff that you talk, you got to these help remove that, and you go to the dentist thing. Is that a normal thing that should happen, or is that caused by microbiome?
Like plaque buildup?
Yeah.
So that's the biofilm. It depends on your diet.
Okay.
So if you eat more paleo, vegetables and meat, you really won't get much plaque accumulation. You'll have some, but when I see kids come in and they just eat Takis and Doritos and things, their plaque is so thick because they've just been feeding those pathogens all day, every day. And then you add maybe not the best hygiene on top of it. So going in regularly to your dentist, getting cleanings is very important. That's what toothbrushing and flossing is. It's removing the biofilm. That's all you're doing. You're shaking the rug. it comes back, it sticks. And the longer it sticks there, that bacteria can release acid. Okay, it's the acid that's leaching minerals out of your teeth, eventually to the point where it can cause a hole or a cavitation. So what you're doing is just getting that sticky biofilm, the plaque, off, so it doesn't sit there long enough to create that acid attack that can leach minerals out. The bummer is it comes back, and how quickly it comes back and how thick it comes back all depends on your diet and how you're breathing.
Things that are good for the teeth that you mentioned, are those also good for the gums? Like, what about people who are like, I don't have cavities, but I have gum issues or bleeding gums when I brush my teeth? Like, is it all the same kind of causes or
different
solutions?
Bacteria?
Oh,
yeah,
okay.
great. I'm glad we're talking about this. So gum disease, about 80% of the population has some form of gum disease.
80%?
Mild, moderate, or severe.
Wow.
And that can be not only from hygiene and diet or our breathing, but also nutritional deficiency. So vitamin C deficiency, think scurvy. Zinc, B vitamins can impact our gums. There's some genetic predisposition as well. But if your gums bleed, that's a sign of inflammation. Okay, inflammation doesn't just stay in the mouth. And if your gums bleed, now that's a vector, that's a way for bacteria in your mouth to get into the circulatory system. And this is where the oral systemic connection comes in.
Yeah.
So these bad bacteria in our mouth can end up in our brain, can end up in our heart, in our uterus. It can affect fertility.
They just connected it to Alzheimer's.
Yes. So P. gingivalis is the bacteria responsible for that. So not only can it travel to your brain, but it also, these bacteria can release toxins, specifically gingipans for the brain that can create inflammation. And the gingipans are these enzymes that can create neuron degradation and brain tissue degradation, actually. So they did a study where they tested the brains of patients who had passed from Alzheimer's, and 96% of them had P. gingivalis and gingipans in their brains, and compared to people who had passed for other reasons without Alzheimer's and dementia had none. Now, the question with some of these studies is, well, oral hygiene tends to drop when you have Alzheimer's and dementia. But I mean, it's worth exploring whether it's like correlation or causation. Yeah.
What would be the I guess the route of action for someone who's listening is like, oh, my gums bleed. What should I do?
Yes. So I would ask what your hygiene practices. So I think flossing is more important than brushing for this reason.
I've heard that. And
I'm not saying don't brush. People, please don't misinterpret that. However, a lot of people brush their teeth, but not many floss. So keep flossing. I compare it to when kids go to the playground for the first time in the spring and you get calluses, or you start lifting weights and your hands are tender, that you guys don't have that problem now, right? It's the same with your gums. So you need to work them out. You need to strengthen them, make them tough. So give it some time. Like,
you do that, right? I was gonna say, I feel like every time I've ever been inconsistent with flossing, when the first time you come back, they bleed, and then a couple times.
Yeah.
That's common. Yeah. But some people are like, it's happening every time.
Bleeds all the time, and people normalize it. But imagine if your arm just bled every time you touched it.
Right.
So people normalize that. We call it pink in the sink. It's a definite marker, red flag that you have inflammation and gum disease. So if that gum disease it stays with you and it becomes chronic, that can lead to periodontal disease. That's when you start having collagen breakdown, ligament breakdown, and bone breakdown. That's when teeth can get loose. You go to the dentist and they're like 3, 4, 3. They're doing probing. They're testing your periodontal health. How is the attachment health? And it's the periodontal pathogens that are gnarly. And so they can impact fertility. So, these pathogens can impact sperm mobility, sperm motility. Women who have gum disease can take 2 months longer to conceive. So if you're having fertility issues, one of the first things I say is, what's your oral health like?
Wow.
Let's do some oral microbiome testing. The cool thing with oral microbiome testing, just like gut mapping, you may say, well, my mouth's perfectly healthy. And this happened to me, actually, personally. A few years ago, I did a salivary analysis, and I was really high with F. nucleatum. And that is a bacteria that's now associated with breast cancer, colon cancer, and pancreatic cancer. It was through the roof. I have no idea how I have it, why I have it, but I did a very targeted approach to reduce it, and it involved antibiotics and some stronger rinses and things like that. And then I retested 3 months later, and it wasn't zero, but it was less into a normal range.
Wow.
Yeah. So it's important to test.
So the treatment would be flossing often and changing your diet and
Yeah, I would, if you keep getting bleeding gums, there can be certain gene SNPs that make you more prone, but I would be interested in your nutritional status. So doing like a full workup, ideally probably with a functional medicine provider who's going to test what is your micronutrient status, your vitamin C status. Vitamin D can impact gum health too if you're deficient.
Do we see benefit of taking a probiotic, like traditional probiotic pill with oral health?
Yes, absolutely. There are probiotics targeted to the oral bacteria. So a really nice protocol is, I like tongue scraping. That's to get some of the bacteria off the dorsum or the surface of your tongue. Floss, brush, probiotic.
And is it in the mouth that you keep the probiotic, or do you just swallow it?
Yeah, it's just a little, usually they're mints. Some are drops.
I didn't know that.
Yeah.
Wow.
Yeah, so they're targeted to the species of bacteria, the healthy bacteria in the mouth.
Oh, interesting.
So it's a separate than the gut. Now, I really believe you can't have a healthy mouth without a healthy gut, and vice versa.
You got to work them together.
Because the
it
mouth
just feeds it right back.
The mouth is the gut.
Yeah.
It's all one tube, and we swallow 2,000 times a day. So if you have pathogens, you're swallowing that bacteria, and some of it can survive the stomach acid and cause problems downstream. And this is maybe why we're seeing colorectal cancer with certain species and things of that nature too.
I have to ask you too, I know there's so much to cover with the mouth in general, but also too, like grinding. And this has been a chronic thing for me that I've been trying to figure out. And so I heard somebody had tied it in with parasites. There's some connection there. And like, is there any other connections? And, what have you found with people who grind their teeth?
We just think it's unresolved anger that you have.
It can be. So let's unpack that. So grinding's hard.
I need therapy and
So the first thing I think is potentially an airway issue. Okay, so when you get into deeper stages of sleep, if your tongue falls back into your pharynx, essentially, what are you doing with grinding? You're moving your mandible forward to try, like, think of CPR. You're opening the airway like this, okay? So it could be an airway issue. You need that evaluated. It can be a sign of nutritional deficiencies, so mineral deficiencies, magnesium. So a lot of patients report when they up that, become more optimized, again, in functional medicine ranges, not conventional medicine ranges, they see an improvement. There's a genetic component to it too. So it can run in families. It can be absolutely stress-induced. Anger management issues, as your colleagues are saying. But parasites, so they don't fully understand the mechanism, but parasitic activity does increase during the night, nocturnally, and we do see an uptick, especially in kids who are grinding. They do stool tests, and they can show really high for parasites too. And you clean up the parasites, and then the grinding does stop.
Pinworms, right? Wasn't that the one I think?
Pinworms is common, and it's really common in kids. Think how often kids are putting things in their mouths, and
my youngest has it too, and I see a little bit of a genetic link there because my mom had it, and my brother has it, and. So, but I mean, I'm going to explore all those options because it's just been this chronic issue.
Are you using now, because now we see the world of peptides really exploding, especially there's peptides for gut health like BPC and I would imagine they would probably help with mouth health too, or gum health as well.
It's just blowing up right now. Okay. So there are remineralizing products that have peptides in them too to help boost with cavity arrest modulation. So there's some brands that are out that the dentist has to apply though, so that comes with cost. They're being used now in root canals to regenerate pulpal tissue, or just help with gum health, things of that nature too. So this is a conversation I'll have a lot more to share probably in a year or two, but for sure dentistry is exploring peptides. Absolutely.
Interesting.
Yeah.
Tell me, now we can get to why it's such a bad idea for me to be doing Tums this whole time that I thought I was doing good by my mouth there. So what's the deal with Tums?
I'd have to
That's
look at
marketed as like healthy,
again.
good toothpaste.
Yeah. I mean, the enemy of good is perfect. Perfect is good. You know that phrase. Yeah. So
it's better than Aquafresh,
Yeah.
Better than my strawberry Colgate.
What's so interesting, I grew up in Maine, and so I remember going to farmers markets and seeing Tom's of Maine at booths. Like it was teeny mom and pop. And it was pretty legit then, but then Colgate bought it out.
I didn't know that.
I can't remember the year. 2008, 2010. I don't know.
And they definitely changed the formulation.
Yeah, they added. God. Yeah, they did. So Tom still has sodium lauryl sulfate, which is a foaming agent. It basically is a derivative of like a floor cleaner. Yeah. So your toothpaste really shouldn't foam or burn. And this is a mindset shift.
That's so funny.
We all like that.
Everybody's like, oh, it burns.
Yeah. I know. Because you feel clean.
Yeah.
Yes.
And some people can't get past it, and that's fine. But it really shouldn't, because it's carpet bombing your mouth. That's why I don't love essential oils in toothpaste. It sounds good, but we want to be mindful of what we're doing to our healthy bacteria. So the foaming too, it can disrupt the mucosal integrity. It's just like we now aren't using shampoos and things that foam. It's the same for your mouth. So I also, I'd have to look at the ingredients. They might.
I have Doug pulling it up right now.
Well,
in 2006, they bought them, and it was from Maine. Tom's of Maine is where they originated.
Wow, they're for $100 million.
Yeah.
In 2006, by the way. Well done, Tom.
Yeah, wow. Way to go, Tom's.
They did a good job. What about brushing your teeth like baking soda or activated charcoal?
Yes, on baking soda, no on charcoal.
Okay.
So there's something called the Relative Dental Abrasivity Index, RDA.
Oh.
So how abrasive is it to your enamel? Charcoal will trash your enamel. It's going to do the opposite. So it's going to wear down. Yes, it's going to wear down your enamel. The layer, the dentin layer underneath your enamel tends to be more yellow. And so if you're wearing down the nice white enamel, you'll have the opposite effect. It can make your teeth over time more discolored, but also sensitivity. So I give a thumbs down to charcoal, but I love baking soda. I really do, because it will neutralize and buffer. It actually raises the pH, and it has a low RDA too. And it's a essentially no cost, low cost thing that people can use.
What about oil pulling? That was a thing for us for a while.
Yeah, I still like oil pulling. I think people think it, fixes everything. Yeah. I'll do it occasionally. It feels good. What it's doing is disrupting the biofilm, and then coconut oil does have some really nice properties for balancing the oral microbiome.
Capricolic acid, is that what's in there?
Yeah, and linoleic, and but it is antimicrobial, so I wouldn't overdo it. It's very mild, but again, if you want to be a purist here, I just think less is more.
So xylitol, that's probably what's bad in here?
I love xylitol.
Oh, okay, xylitol is a good thing.
It's a sodium lauryl sulfate.
So there's the ingredients.
Carrageenan.
What?
Carrageenan.
Oh, that's not good.
That isn't the best.
Okay.
And then peppermint oil.
Peppermint, yeah. Okay, so if I'm going to be, I would just say the SLS and the peppermint oil. But it could be worse.
Okay, I was going to say, so it's
could be worse.
It's better than, the
brushing your teeth.
But I would be interested
with like Crest or like any of the other ones that are like the main
that are gross.
Okay.
I can't even put those in my mouth anymore. They like hurt. They physically hurt.
Yeah, I haven't had that kind of toothpaste in forever.
But you try this over here and just see if you notice a difference in a couple weeks.
No, I'm super excited to try that. And I mean, I get questions all the time, and like I've never had the best brand that I've been recommended before. I thought was Tom's.
So how developed is this field of functional dentistry? 'Cause I remember functional medicine. So I had a wellness studio a long time ago. I sold it about maybe 10 years ago. But I remember 15, 18 years ago, I had somebody in there she was ahead of everybody, and she would talk about functional medicine. And then I remember us trying to find a functional medicine practitioner, and it was very difficult. Now you can find them all over the place.
Sure.
Is it like that with functional dentistry? Like someone's listening and they're like, cool, I'm going to go find a functional dentist. Are they like very difficult to find?
So we are where that was 10 years ago. Right? Yeah. We're creating it right now. I mean, if you're on social media, it will seem like there's a lot, which is great. People are talking about it. And I get messages, DMs from dentists saying, I want to practice differently. I hate dentistry. Because it really is, it's a challenging career. If you think bigger, if you think outside of the box, if you want to look at the oral systemic connection, traditional dentistry, it's really hard to go in every day when you're just feeling like you're not moving the needle at all, just, putting out fires. But people don't know where to get trained. How did you get trained? Yeah. And so how did I get trained? I flew all over the place. I spent tens of thousands of dollars on courses. I read books, I extrapolated all of this information. I looked at Weston Price. I looked at other colleagues who are paving the way, but it's just a handful. So we really need a standardized training program.
Have you considered building a course?
Well, the Institute for Functional Dentistry is a course. So we're launching this summer. And so the concern I have is that we need to get the mouth back into the body. And so dental curriculum is really focused on really oral health. We focus on the teeth, how to fix the hole, how to do the root canal. Very little in medicine and nutrition and the oral systemic connection. What's missing from dental curriculum is medicine, hormone pathways and, immune function, the oral systemic connection, the oral microbiome, environmental toxins. And so our program, they will get functional medicine training, which is foundational, to then build up to their functional dental training. So we're very excited for that. And I'm hoping it helps. There are, databases out there where you can find functional dentists. I just argue you don't know what you're going to get because there's just no certification.
There's no standardization.
You could say, oh, I screen for airway health, or I don't use mercury. I'm a functional dentist. And I'm like, you're different. You're looking at things differently, but it's very involved.
Now, will you have to be a dentist already to then go through this process?
Yes.
Yeah.
Okay.
Dentists and hygienists will be able to too, because the hygienists are very important for all of this as well.
Got it.
So typically when I talk to someone like you, there was some crisis that motivated them to move outside of their where they were. I mean, you were already a dentist. You were practicing. You were picketing for fluoride. Was it the fluoride that debate?
By the way, you got to use that as like a picture in your speeches. I feel like you should start with that.
I wish I
like,
had a
on the other side,
photo.
because that would be a great. Like,
I need AI to help create a photo for me. I don't have any photos of it.
What was it that motivated you to move outside of your, what you were doing? Because you were already a dentist. You were practicing.
Yeah. Well, that's such a great question. It's so layered. So I lost both my parents very young to preventable disease, cancer, lifestyle factors. So that's when I personally shifted into doubling down on longevity and health. Even from my teen years, though, prior to their passing, I just was really interested in nutrition science and human optimization, but I just never applied it to my career because no one was doing that. Right. It's like I lived two lives almost. But then I got out. I actually was a general dentist for many years, and I hated it. I was going to move to like Costa Rica and surf, or like New Zealand and snowboard. I couldn't stand it. I hated it because it's disease that comes in. And the way the system's set up right now, you don't have time to educate your patients on true prevention, do nutritional counseling, run labs, like let me help you. It's really turn and burn, which is why dentistry, I think, deserves to be the brunt of the joke sometimes. I mean, we're just putting out fires, right? So I was really dissatisfied. So I thought, gosh, I'm going to get more upstream. How do I get more upstream? Kids, right? Education. So then I went back and got board certified in pediatrics. And then I got out and I realized, it's the exact same thing, except now it's even more turn and burn because pediatrics is faster. You see more patients a day. And I just said, there has to be a different way. And I thought I was practicing differently. I wasn't doing mercury fillings. I was not judgmental if parents came in not wanting to use fluoride. I was trying to talk more about the oral systemic connection, but I didn't have enough training. And this dad came in and called me out one day. And he was like, you're not a holistic dentist. At the time, it was like holistic dentistry. You're not a holistic dentist. Do you know who Weston Price is? And I was like, I don't. Again, this was like 12, 13 years ago. And so I went and read more about Dr. Price's work. And then Dr. Stephen Lin is a dentist out of Australia. He modernized Price's work with the book called The Dental Diet. And I just noticed, gosh, if I just spend a little more time with my patients and talk about nutrition and show them how to brush and floss and why it's important and talk about the microbiome, when they come back to see me, they're healthier. They don't have these repeat offenders, like cavities keep coming in, their gum disease improves. And I was like, this is so subtle and really easy, but it just takes a mindset shift. And I just kept building upon it. So it was really coming from dissatisfaction in my career,
So strengthening bone in the body, strength training really helps with that. Is there anything that we could do with the mouth? Like you've seen people come out with like jazzercise,
yes,
or like chewing gum. Like we don't chew. Is there anything we do exercise-wise for our mouths to strengthen our teeth and our jaws and all that? Yeah.
So out of the gate, if you can breastfeed, that's the best. The best thing to optimize the airway in your child is to breastfeed if you can. Not every woman can, nor does it resonate, but if you can. baby-led weaning, chew on lamb bones and, bam, bam type of stuff. Introduce real foods, crunchy foods, carrots, apples, meat through childhood, less processed foods as much as possible. There's something called a Myo-Munchie. It's a myofunctional appliance. It's medical grade silicone that you can chew on. I actually have one of those jar size things. It hurts. Like, I don't feel the angle is right. And I think it could cause a lot of temporomandibular joint issues. But yeah, in theory, these are muscles, and our tongue is a muscle. And that's where myofunctional therapy comes in. So there are different exercises. You can use that Myo-Munchie. With our kids, we talk about doing clicks, pops. There are things that you can do to strengthen the muscles too. But just having a whole food diet and chewing, we tend to inhale our food, like actually chew, because that's going to help with digestion and just have profound benefits too.
This might be a weird question, but do we notice any differences in languages and their effect on, you're talking about moving the mouth, and I know different languages require different mouth movements. Is there any data to show?
I don't know. Okay. That's a great question.
Okay.
Yeah, like especially Thai.
There's a connection to healthier teeth with people that talk a certain way.
Just learning different languages would exercise your mouth. I mean, I grew up in a Italian household.
You mean being like bilingual or something like that? Okay. I thought you meant like different languages, like they have better teeth because they speak speak Russian.
Or just exercising the mouth. I grew up in an Italian household, and Italian words, they use different parts of the mouth to pronounce than English words, and I'm sure
I understand what you're saying.
Okay.
I think that'd be fascinating. Okay. Yeah, I don't know. Okay. But it would make sense because it is, speech is a red flag. Delayed or challenges with speech is a red flag in kids if they have a myofunctional imbalance.
Right.
We usually don't make that call, and I'm not a speech language pathologist by any means, but generally they make the call between 6, 7, 8 years old with certain sounds. Okay. So that'd be interesting. I'll dig into that for you.
Well, since we're asking weird questions, I was waiting for an opportunity to ask this question because it's so in left field, but it didn't feel right anywhere. Okay. Do you remember when I talked on the podcast about my roommate that had the chronic bad breath?
Yeah.
Oh, yeah.
So what is the connection between somebody who does cocaine and chronic breath?
Yeah.
Probably their sinuses, like post-nasal drip, and they probably just have pathogenic sinuses. That can just that can put a hole in your septum. I mean, they might have infection up there. I bet they have chronic sinus infections.
Okay, that's when you were starting to talk about the sinus stuff. I was like, I bet it has something to do with that.
Yeah.
Like, it was the worst breath I'd ever smelled. Yeah. And I remember it was so bad that this is before I knew he had this habit. I didn't find out about his habit till after he was no longer my roommate, and I found all the paraphernalia. And I remember we'd get in the car together, go to work, and his breath was so bad it would stink up the whole car. So bad that I remember, I got to see if he's brushing his teeth. That I remember the next morning, like watching him scrub his teeth, going like, this dude's brushing his teeth. How is it possible his breath could be that bad?
Okay, I have theories. Now I'm thinking about it. Okay. So there's probably a few things. He probably has chronic sinus infections. Yeah. He also has dry mouth.
Yeah.
Because that's what cocaine does.
Yeah.
Okay. So think of methamphetamine addicts too. Their teeth are just jacked up.
Right.
Part of that is from losing the integrity of your saliva. It is dietary choices too when you're on these drugs, but also mouth breathing. Yeah. So if you have chronic sinus inflammation because he's snorting it up there, it's all stuffy. He's mouth breathing. Yeah. So that's going to change his microbiome, drop the pH. He'll lose his saliva. He probably has like tonsillar inflammation. You're swallowing the cocaine. It's messing up your gut microbiome. So he's probably not flossing.
Poor guy. If he ever listens to our podcast,
sorry.
I'm okay with shaming this dude. I found razor blade marks on my window seal and half straws all over the place.
It's kind of fair game.
So I should have known. I mean, I was in my 20s, so I was still a little naive and didn't connect the dots of the guy playing video games till 4 o'clock in the morning
with his jaw. Talk about working on your jaw.
So what about with parents when they give their kids juice all the time? My wife has a younger brother who, when they were little, they would give him in his bottle apple juice all the time.
A lot of people do that.
And all his baby teeth rotted out. They all got totally. So that's terrible.
That's terrible.
Well, you ever seen apple juice compared to like soda? It's like damn near the same amount of sugar.
Yeah. So yes, and I mean this has to do with blood sugar too. So how many apples does it take to make 6 to 8 ounces of apple juice? It's a lot. It's way more than you could eat physically with
Without
a real apple with fiber. Yeah, I'm not a fan of juice. I mean, my patient population, I'm lucky. I just don't see a lot of juice drinkers, but I know it's still a thing. It's the fastest way to destroy teeth. Think of it like soda. So if your child needs juice, let's say they're constipated or your pediatrician wants, that's a whole other conversation. But if your pediatrician wants one juice, just dilute it. Just try to give a little bit every day, dilute it in water. But our kids just get too much sugar. Yeah. I mean, they need to learn to love water.
The beautiful part is if you actually, as a parent, and this is for the parent that has a kid on the way, if you discipline yourself not to do it. I mean, my kid's 5 now, and you couldn't get him to drink juice.
I know.
He don't even like the taste of it.
Mine are the same.
Yeah, he wants water.
If you're expecting or going to be a parent out there listening, be super strict in those first formative years. Yes. It pays off in spades. My girls are 9 and 11. I'm starting to lose control. They go over to friends' houses and they're after soccer games. They're getting exposed to this food that I would never bring into the house. And they're usually just not interested in it, and they're very adventurous eaters. And you may feel weird at first and, say, oh, we're good with the goldfish, or we just eat, seaweed snacks or fruit and veggies and meat and cheese, but it will pay off.
I always feel bad for the parents that are trying to reverse this after 5, 7, 8 years. But if you're new and you're just starting, like, I can't stress enough how by not introducing it, they won't know any better. And then when it's inevitable, it gets introduced to them, they don't like it.
I've had adult clients that thought they would say that, and I had a few of these. It happened more than once where they'd say, "I don't like the taste of water." It's because they were so used to drinking.
It's conditioned.
Yes, something with flavor, and you develop that as a child. You develop that preference.
If you form those first 1,000 days, those first 3 years of life are so important for microbiome development, oral and gut, but also palate. You're shaping the palate, and so if they're getting sugar, children are drawn to sugar. This goes back ancestrally too, because in the forest, foods that were sweet, mother's milk or berries, were safe. Foods that were bitter, poison. Okay, so there's a reason for this, but you need to control it. So I do say, I agree with you. Give water. Your kids don't need juice. They don't need soda at the party. That's one thing. We're hard no soda at my family because it's acidic, it's sugar. I just don't want my kids developing that palate, But
do you see any connection between any non-nutritive sweeteners, artificial sweeteners, or stevia with any oral health issues?
There's some research on some of them with gut microbiome dysbiosis, and there's some studies maybe. Xylitol I really like in toothpaste. Because it will modulate the microbiome. It reduces plaque formation. It can act as a anti-inflammatory agent. It's like a prebiotic too. But swallowing a lot of these things, baking with it, cooking with it, drinking drinks with these things, it can affect gut microbiome, maybe increase uric acid. There's some studies on that too. So just be cautious,
And milk when we grew up in the 80s, milk was, good for your bones. Is that still true?
Are we going to do the raw milk conversation right now?
Please. That's what we give my kids. My kids drink, my daughter, I should say. My son can't tolerate dairy like me, but my daughter can. Yeah. And we only give her raw milk. So why raw milk?
Less processed. Yeah. Higher in nutrient density. Yeah. This gets controversial very quick. I can't even get it in Oregon. I have to mafia it in. Yeah. I'm serious. I have patients that come from Washington State and they'll bring me raw milk.
Have you seen the videos of the agents going in and
it's like some big drug bust. Yeah.
Well, I mean, the Amish were apparently incredibly impactful in this election because of what was happening to their milks. I read that somewhere.
Well, I didn't know that.
Which makes sense, right? They came out in droves voting because they want to be able to supply raw milk. Anyway, milk is great. It has vitamin D and healthy fats, and as long as you can tolerate it, I think quality dairy is very important. Calcium, phosphorus. I'm very pro. I tend to lean more towards the least processing of things as possible.
In general. Okay. Awesome. What's the biggest pushback you get from your community talking about this? I can't imagine too much, but there's a lot.
Yeah, there's got to be some dentists.
I get some gnarly messages.
Really?
Yeah.
What is it? Is it the fluoride talk?
Disrupting an industry, dude.
Oh, yeah.
Disrupting industry and money, and it's always going to be.
What's the biggest? What are the biggest
my tell-all about dentistry, my book coming out. Oh, I'm just joking.
Okay.
It's on my list of things to do. No, most everyone's very supportive, and if they spend this time talking to me, they realize I have really good intentions. It's we're all on the same page. We want healthier patients. We're trying to help our patients, but from the outside, it is that I think people feel threatened, and it's hard to say what I say without attacking the individual. I'm not saying dentists are bad. Again, it's the institutions that need to change, I think. It's a mindset shift. But I would say the number one thing is my stance on fluoride.
You're the type of person who's a great person, though, to do it, because you admittedly were on the other side of the fence.
Thank gosh I have that story.
It is. It's a great story. Because, I feel sometimes you people are very skeptical of these charlatans that come in and decide they're going to create this space. And it's like, no, I was on the other side advocating for this. And then I woke up and realized what was going on. And so. Yeah,
I just want to touch on that again. So, the argument is, well, fluoride helps teeth. And I think most of us, we're not arguing that, even topically. Like, systemic's different, but what is it doing to the rest of the body? Like, why are we only focused on teeth? And that's the difference. The pro-water fluoridation group, in my opinion, has the same intention that I do. We care about patient health. We want to optimize our, the health of our brothers and sisters, but they're just focused on teeth and cavities. Yeah. What about the brain? What about the thyroid? What about the skeletal system and the gut? Because it is all interconnected. So, but I would say water fluoridation, it's not frequent, but when I get it, it's nasty.
Wow.
It is really nasty. And it's usually very misogynistic and it's crazy. They go wild. Wow. And one in particular who trolls me.
I don't know, how can you be misogynistic with fluoride?
Because I'm the fluoride, fluoride Action Network's darling, and they just put me up there. Oh, wow. They just put me up there for like candy, whatever. It's just so dumb. And he'll say things like it's fear porn. He loves to say porn all the time in emails he sends me. This guy is on the board of the water.
There's one dude.
Well, he in particular, there's a lot, but there's one guy in particular. He won't leave me alone. I block him. I'll share more details offline of who this gentleman is, but there's a reason that he, I think, is so upset.
Is there any truth to the part of the fluoride, like, just all the information? Was there any truth that it was an expedient way for companies to get rid of fluoride was to dump it in our water? So it was like a cheap way to get rid of this chemical byproduct? There is.
Yeah, so it is a byproduct of the phosphate fertilizer industry. Oh. So back in the day, so the history of water fluoridation. So in the early 1900s in Colorado Springs, there was a dentist there, Charles McKay, I believe was his name, and he noticed his patients all had fluorosis, which was mottling of the teeth, which is the first sign of too much fluoride. Okay. And they estimate up to 40% of teenagers now have dental fluorosis.
What's mottling? What do you mean by that?
Like white, brown spots in the teeth.
Oh, okay.
Maybe we can show it up there.
Yeah. So.
Oh, look at you. Yeah, that's my institution. So he made an observation that he felt maybe their enamel was more acid resistant. They were getting less cavities. And so some people did some very preliminary research on this. And basically kind of went wild with it, and they put it in the water in Grand Rapids, Michigan in the mid-40s without any long-term safety data and not really much substantial efficacy data. Wow. So the phosphate fertilizer industry, to get rid of this fluoride, was very expensive. It had to be shipped out. It was considered a biohazard. But what they did instead is they packaged it up and sold it to municipalities to put into the water. And so if you look, and this all sounds like conspiracy theory until you really start learning about it and realize, well, it's actually true. If you look at how does fluoride come, it comes in like cement bags. It's hydrofluorosilicic acid. So it's acid, skull and crossbones on the front.
Oh, wow.
And you have to wear a hazmat suit to pour it. And I've spoken to the people working at these water plants that are doing this. And if you speak to most people that work at these water plants, they are absolutely opposed to water fluoridation. and they're the ones putting it in the water.
So
the other thing too, it's very important. So we keep saying 0.7 milligrams per liter is perfectly safe. That's assuming you just drink 1 liter of water and don't get it from any other sources. But if you test different municipalities, you'll see it's not always exactly 0.7 milligrams per liter. It's really hard to keep it at that level. And so I've worked on campaigns where we've tested water, and I've seen it as high as 2.2 milligrams per liter, that is shown in the data to be too much.
Wow.
So again, I just think it's antiquated. I think it was well-intentioned at the time with the science we had at the time. This was before evidence-based medicine.
And it just conveniently was a cheap way to get rid of this chemical byproduct.
They thought they were helping the cavity epidemic.
So
but
you
what's
guys can
interesting,
take your tinfoil hats off. It's not trying to make the society dumber. That was not the intent of it.
There are people that say that.
There's absolutely, that's a conspiracy theorist is like, this was all intended to make us dumber and more controllable.
He had that, and he had lead and all these things happening at the same time.
I think it was well-intentioned, but when you know better, you do better. And again, it should be a choice. If people want to use it in toothpaste. But I just think it's very antiquated. And, we need to minimize risk. Our kids are getting sicker.
Yeah.
Like, this is not up for debate.
Fact.
So let's get rid of some easy, low-hanging environmental toxins, or not even, things that we're adding.
Stop putting acid in
Stop.
Let's start with that.
Can we create programs to educate on nutrition and diet? Like, let's get our pediatricians on board. Let's get OBGYNs talking about how moms can optimize themselves during pregnancy so their kids' teeth come in healthier. Vitamin D optimization and movement and sunlight. I mean, I could go on and on.
Well, by the way, Adam, it's 2025. Conspiracy theorists are like 10-0.
They are winning right now. There's still some crazy ones out there.
Just
there are.
There's some crazy ones.
And I do find them because I speak about this, they come to me and I'm like, whoa.
Wait a minute. Do you think the lizard people are
We have to be science-backed still. This has to be evidence-based.
I mean, I'm with you. I think, generally speaking, I'm not saying all at all, that I think most stuff is well-intended. And then I think what happens a lot of times is there becomes the well-intentioned ends up being a huge industry of money, and then it's hard to reverse.
The ship is impossible.
Well, yes.
Somebody's buying millions of dollars worth of those bags to put it in that, and there's a business out of that, and they certainly don't want it to go away.
Absolutely. You're right. And also, it's important to know, the American Dental Association, the American Academy of Pediatrics, these can be pretty pay-to-play organizations. The ADA does take money from 3M, Henry Schein, Colgate Palmolive. Those companies all make fluoride products. Half of their product line is heavily fluoridated.
Speaking of which, it's always 4 to 5 dentists. I want to know who that other dentist is that never
Might be me.
So are you hopeful with because you're somewhat involved with this kind of movement that we're seeing with making America healthy again? You spoke are you somewhat hopeful for the direction? I mean, from my perspective, I've never been hopeful with government policy on. It's always been the opposite of healthy. But for the first time ever, I'm hearing things and going, maybe we're moving in the right direction.
Yeah, I was involved at the Kellogg's rally where we went and petitioned. There were 400,000 petitions. It was with Vani Hari, the food babe, to talk about getting food dyes and the BHT preservative out of our kids' cereals. And people say, well, that won't move the needle, but it has to start somewhere. And it's the movement. Why I'm so hopeful is people are talking about it.
Yes.
And also people are talking about water fluoridation. Do you know what a dream it is to have that on the front page of the Washington Post or the New York Times for me, who's been reading these studies and just thinking I'm crazy because no one else is talking about this. My colleagues, blinders are up and they just go with what the ADA says. And to their defense, we're so busy. Medical dental providers are so busy. It's really hard to dig into the science and the literature. It's also really hard to go against the grain. I lost referrals. I still get hate mails and hate emails because of how I feel about water fluoridation, for example, or just practicing dentistry a little differently, because people do get offensive. They feel they're defensive about it and offended. But I'm hopeful. I am hopeful. We need to clean up our food system. We need to fix the chronic healthcare crisis that's happening, figuring out the whys, and these come with just conversations. And I think we're at a point, it's just contentious because change that's what happens in change.
Yes.
There's a lot of turmoil right now, and people are butting heads. What's a bummer is that it's become political, which maybe you could argue it had to. I don't know.
Almost
but
like everything has to be these days. What are the top 5 holistic approach? Like I've even heard like things like, brushing our teeth is like a new thing. If your diet and your water intake was right, we probably wouldn't even have to brush our teeth that much. So if you were to list like number 1, number 2, number 3, number 4 holistic approaches to having a healthy mouth, healthy teeth, what would you rank 1, then 2, then 3? Like, how would you do that?
Yeah, I mean, I see this online with some influencers. They'll say, I'm carnivore, and so I don't brush and floss. And in theory, they're right. However, I don't recommend that because no one is really eating that way. It's such a rare percentage.
But based off that, wouldn't that make diet become higher?
So I would say diet is number 1.
Okay, number 1.
Absolutely diet. Eat a rainbow, whole foods, high quality protein sources, hydration, what you put on your fork matters tremendously. Number 2 is airway. How are you breathing? And those are a little interchangeable, I think, but how you breathe, kids with sleep disorder breathing or airway issues, there's a link to ADHD. Okay. So if your kid has ADHD, has anyone screened for their airway health? And you would say, I'm going on a tangent here, but why is that? If you're not getting into deep restorative sleep, you're also very likely not having a proper hormone release, and hormone can be very regulating. You might be in fight or flight constantly, sympathetically overdriven. You're also not getting enough oxygen. The brain is actively developing in childhood. So when you breathe through your mouth, you get 20% less oxygen. So breathing is really important, not only for behavior, mood, growth. Growth hormone is released in deep stages of sleep, but also oral health too, which we spoke about earlier. So I'd say nutrition, airway. I'd say, hygiene practices matter, particularly flossing. So again, most people aren't. A lot of people brush, but people aren't flossing.
So you'd even put flossing over brushing?
Yeah.
Oh, yeah.
Oh, okay. That's good to know.
I would even maybe not even have brushing in the top 5, only because if you're eating a clean diet, your tongue does clean the outside surfaces of your teeth a lot. Yeah. But I'll just say oral hygiene. So flossing, brushing.
How problematic is it to be like a hard brusher?
Very.
Is there anything you do soft, bro?
Everybody tells me that.
Can you calm down?
It's like, you know how they have the bristles?
I know it's all like this.
Yeah.
Why is Justin's toothbrush like this after 2 times?
Normally brushing.
Very, very light, like Bob Ross, like paint lightly.
Well,
so
baby
you're
trees.
Too hard because you're wearing your enamel.
Yeah, I've heard so the electric ones are good for that. So it regulates.
It can, and just lighten your grip up a little bit.
I'm just being honest, dude.
I'm so glad you're honest. Because I'm sure you're not the only guy.
I know for a fact.
I'm sure you're not the only guy out there that does everything hard. You know
I can't help it.
A lot of people brush too hard. Yeah. They do. They really do. And they wear their enamel away. They have sensitivity.
So just floss. I'm going to move over to
floss. Yeah. And if you can't floss, water picking is a decent substitute too. Okay. So water flossers. Okay, number 4, I say supplementation, oral microbiome, and just nutritional supplementation, but test, don't guess, ideally. But most of us are vitamin D deficient or vitamin K2 deficient, Weston Price stuff, and mineral magnesium deficient. So when the kids come in, I kind of just like everyone on a vitamin D3, K2, and a magnesium blend. And I know the purists out there, like, we should be able to get this all from our food and sun, but we're in modern society, we're inside, we're not optimized. So be open to it. I would just say, why just be optimal. Number 5, and prebiotics, probiotics with that too. I guess I'd say hydration.
I was just going to ask you, were you including water in the
I'm going to throw it back. I mean, hydration. I mean, these are interchangeable a little bit. But if you have dry mouth, you will be more prone to cavities. And the quality of your saliva too. So is it mineral optimized? Do you have enough calcium and phosphorus in the diet? Your saliva, it's this golden elixir of your body. It protects your teeth, but it is what helps with the remineralization exchange.
I just thought of something right
Love
now.
it.
Can you catch cavities in that case? Can you make out with someone?
Yes. So, yay! I'm glad you brought this up. Cavity, yes, bacteria is transmissible.
Especially if you make out hard, like French style.
So there's actually a study.
You do it really hard too.
There's a study that says you need to kiss.
Chicks dig it.
11 times a day to like exchange enough so it sticks.
Okay.
So anytime you kiss, let's say you have a first date or one night stand, there will be an exchange, but it's transient. But bacteria is transmissible. So most babies are born with pretty neutral oral microbiomes. They get it from their moms. But it's a caregiver that inoculates them with either strep mutans, but also candida is really, really well documented now to influence early childhood cavities too. So you'll find families tend to have the same microbiome. So let's say you have terrible periodontal disease and you have F. nucleatum, which is linked to cancer. We should test your spouse. I bet she has it too, even though she's asymptomatic. So we usually need to treat both people together.
Otherwise you're getting one.
Exactly, because you're just going to get it again because she's going to re-inoculate you. So,
I didn't need to know that.
Anytime you put your mouth on this. Well, this has been incredibly enlightening.
So good.
Yay.
Awesome. Who would have thought?
So good. This is so great. I wish people like you were easier to find.
Tell us where everybody can find your toothpaste. I know I haven't tried it yet, but I'm a believer.
Your difference
already.
In your toothpaste,
So because I look at things differently, I just couldn't find the toothpaste I really loved. There were some good ones out there, but I still felt so many of them were disruptive to the oral microbiome. So I partnered with Dr. Mark Berhenna, who's on social media as well. And we founded FIG, which stands for Feed Your Good Guys. And
that's cool.
So it's oral microbiome. That's the premise of it. So we took out all the emulsifiers, the surfactants, the essential oils, the disruptors, and we added in prebiotics and amino acids that target oral microbiome modulation, and it can affect plaque accumulation
so
too.
What's in there? Arginine?
Okay. Yep, L-arginine and prebiotics, and then we have nanohydroxyapatite for remineralization. And we have some pretty cool products launching later this year too. That will be one of a kind.
What about an oral probiotic? I never heard of that before.
Yeah, we have one. So we partnered with Bristle. Like toothbrush Bristle, which is the oral microbiome test. So they're the salivary analysis, which is direct to consumer. So you can go on Bristle's website. I think it's bristlehealth.com. And order an oral microbiome test. You spit, you mail it out. 2 weeks later, you get your results. Now, the problem is, what do you do with the results? They are pretty good about giving you guidelines and protocols, but this is where we need more functional hygienists and dentists to help patients. But this is how I found out I had F. nucleatum through the roof. And that's cancer prevention. Or if you have P. gingivalis, through the roof. That's going to be Alzheimer's prevention. So I think we should be testing our oral microbiomes just like we do blood work. But Bristol has a oral probiotic. And the founders of Bristol, they're oral microbiome researchers. So they're in it. They're in the lab, like studying these microbes, and they created a probiotic. And so we've partnered, so you can get it on our website too, fig.com. Yeah.
Cool. Awesome. This was great. Thank you so much for coming on the show.
Absolutely. Thanks for having me, you guys. Appreciate it.
All right. I know you liked that episode. If you did, check this one out. One of the keys to fat loss is protein. It's true. If you're not eating a high protein diet, you're not going to burn as much body fat as you can. So in today's episode, we're going to talk about the smartest ways to use protein for fat burn and to build muscle. You got to watch this.
I wish I understood this earlier in my career. I think it was probably almost 10 years in when I started to just focus on this with clients.
I knew it was important, but I don't know how important.
Yeah, I knew it was important, but I also didn't